Good evening, everyone. At the outset, I would like to thank Dr. Sudeep Gupta sir for giving me this opportunity to give presentation on supportive care in breast cancer. So, myself, Dr. Amol Dongre, and I'm a senior consultant at Nagpur, medical oncologist. So, my first abstract is basically a cardiac safety of dual anti-HER2 blockade with pertuzumab plus trastuzumab in the affinity trial, and this abstract has been presented in ASCO 2021 annual meeting. Is done by Evandro D. Azambuza et al. So, as we know, trastuzumab increases the incidence of cardiac events in patients with early breast cancer. Dual blockade with pertuzumab plus trastuzumab improves breast cancer outcomes. We all know that. And it is a standard of care for high-risk HER2 positive breast cancer patients following the phase 3 affinity trial that evaluated the addition of pertuzumab or placebo to trastuzumab and chemotherapy. So, basically, the aim of this study is to know the cardiotoxicity of dual anti-HER2 blockade. If we come to the design of study, affinity trial eligibility required a left ventricular ejection fraction of more than 45% at study entry, and LVEF assessment was performed every 3 months during the treatment and every 6 months up to 36 months after that and yearly thereafter. So the primary cardiac events as defined as heart failure, that is either class 3 or 4, or a significant decrease in left ventricular ejection fraction of at least 10 percentage points from baseline and to less than 50% or cardiac death. Whereas the secondary cardiac events are defined as a confirmed significant decrease in left ventricular ejection fraction or cardiac events confirmed by cardiac advisory board. So the safety analysis population consists of a total of 4,769, that is 4,769 patients with 74 months of median follow-up. Cardiac events were observed in 159 patients, that is 3.3% of the total patients, of which 83, that is 3.5% patient in the pertuzumab plus trastuzumab group and 76, that is 3.2% in the placebo plus trastuzumab arms respectively. So the most cardiac events occurred during anti-HER2 therapy, of which of the 159 patients who develop cardiac events, almost 123, that is 77.4% of patients are asymptomatic, whereas almost 83.6% of the patient, that is 133 of the 159 are mildly symptomatic with a mild decrease in left ventricular ejection fraction. There were 2 cardiac deaths in each arm that comprise of 0.1%. More of cardiac events occurred in patients who received an anthracycline-based chemotherapy compared to those who received non-anthracycline-based chemotherapy. That is almost 139 patients who received anthracycline-based versus 20 patients who received non-anthracycline-based chemotherapy as a cardiac events. Acute recovery from a cardiac event based on subsequent left ventricular ejection fraction value was observed in almost 82% of the patient. That is 127 of the patient out of 155 patient had acute recovery from the cardiac events. So these are the incidence of cardiac events by time period. So you can see of all the patients, almost 159 patient had cardiac events, of which 83 in the dual anti-HER2 blockade, whereas 76 in those with placebo plus trastuzumab. Most of the patient develop cardiac events during anti-HER2 therapy, that is 123, of which 62 in the dual HER2 as well as 61 in the trastuzumab plus placebo arm. So if you see the during follow-up, almost 32 patients develop cardiac events, of which dual anti-HER2 is 21, whereas in trastuzumab plus placebo it's only 11. If we see the time to first cardiac event, a median was around 8.4 months of all the patients, whereas in those who received dual anti-HER2, it was 9.2 months versus 7.4 months in those who received a trastuzumab plus placebo. If we see the time to cardiac death, again it's 30.2 months, which is more or less in those who received dual anti-HER2 as compared to those who received placebo plus trastuzumab, that is 35.1 months. If you see the heart failure class 3 or 4, again more of the patient who received dual anti-HER2, that is 16 patient in the pertuzumab plus trastuzumab arm as compared to 6 patient in trastuzumab plus placebo arm. Again, during follow-up, almost 6 patient develop in dual anti-HER2 group as compared to placebo plus trastuzumab. Only 1 patient develop class 3 or 4 heart failure. So there's asymptomatic or mildly symptomatic LVF decrease occurs in total of 133 patients, out of which 65 in the dual anti-HER2 group, that is PER2 plus trastuzumab, as compared to 4.6 in those who received placebo plus trastuzumab. So So dual blockade with pertuzumab plus trastuzumab does not increase the risk of cardiac events compared to placebo plus trastuzumab alone. And the use of anthracycline-based chemotherapy increases the risk of cardiac events. Hence, non-anthracycline-based chemotherapy may be considered particularly in patients with other cardiovascular risk factor. So, if I'm to give my comment, so dual anti-HER2 therapy with trastuzumab pertuzumab combined with standard chemotherapy has received accelerated approval for the neoadjuvant treatment of stage 2 to 3 HER2 positive breast cancer. We all know. And formalized investigations into the cardiac safety of trastuzumab and pertuzumab based regimes are important because these regimes are widely used for the adjuvant and neoadjuvant treatment of breast cancer. So the known role of HER2 signaling in the physiological adaptive response of this heart provides further rationale for study on the potential cardiotoxicity of this dual anti-HER2 blockade. Heart failure may be important in individuals treated with PERTU and pertuzumab, and that LVF alone may not be sufficient to identify those at risk of developing heart failure. There should be other echocardiographic tools, including global longitudinal strain and diastolic function assessment, or monitoring of cardiac biomarkers such as troponin and NT-proBNP, have shown promise in the early detection of cardiotoxicity. So, my take-home message for this abstract is dual blockade with pertuzumab plus trastuzumab does not increase the risk of cardiac events compared to placebo or trastuzumab alone. Most cardiac events occur during anti-HER2 therapy. Use of anthracene-based chemotherapy increases the risk of cardiac events, and non-anthracycline chemotherapy may be considered particularly in patients with other cardiovascular risk factors. My second abstract is health-related quality of life with trastuzumab monotherapy versus trastuzumab plus standard chemotherapy as adjuvant therapy in older patients with HER2 positive breast cancer. Again, it is the original report and is this has been published in Journal of Clinical Oncology, volume 39, August 2021. And the author of this report is Naruto Taira et al. So, the adverse effect of adjuvant chemotherapy and quality of life are clear. However, knowledge of their extent and duration is limited, especially in older patients with breast cancer. So, adjuvant trastuzumab monotherapy with trastuzumab plus chemotherapy in older patients with HER2 positive breast cancer were compared in this trial. And the aim of this trial is to report finding on quality of life in the RESPECT trial. So, the inclusion criteria for this trial is patient aged 70 to 80 years with HER2 positive surgically treated breast cancer. And the intervention they did is random assignment, and patient received either trastuzumab or trastuzumab plus chemotherapy. So, quality of life was assessed using the FACT-G general score, then Philadelphia Geriatric Center Morale Scale, Hospital Anxiety and Depression Scale, Patient Neurotoxicity Questionnaire, and Tokyo Metropolitan Institute of Gerontology Index of Competence at baseline after 2, 12, and 36 months. Comparisons were based on individual changes from baseline and were performed by features test or mixed model repeated measures. So, among 275 patients, 84% of patients, that is 231 patients, were included in the analysis. The average age of these patients was 74 years. At 2, 12, and 36 months, almost 198, 177, and 178 patients completed the survey. The mean FACT-G score at each survey point was 78.9, 80.4, 82.7, and 79.1 in the group who received trastuzumab monotherapy, whereas the mean FACT-G score was 79.5, 74.5, 78.4, and 78.5 in group who received trastuzumab plus chemotherapy. So, compared with group who received trastuzumab plus chemotherapy, the proportion of patients showing quality of life deterioration, that is more than 5 points decrease from baseline FACT-G was significantly lower at 2 months, that is 31% versus 48%. And also it was at 12 months, it was 19% versus 38%, that is p-value is 0.009. So, the basic inference is as compared to those who received monotherapy, those who received combination therapy shows almost quality of life deterioration, that is more than 5 points, and it is significantly lower at 2 and 12 months if we compare both the groups. In group who received monotherapy with trastuzumab, hospital anxiety and depression scale score and the proportion of severe sensory peripheral neuropathy was significantly lower at 2 months, whereas with the Philadelphia Geriatric Center Morale Scale and Tokyo Metropolitan Institute of Gerontology Index of Competence score was significantly higher, that is p-value p of 0.024 and 0.042 at 12 months. At 36 months, there was no significant difference in any quality of life items. So, to conclude, detrimental effects of adjuvant chemotherapy on global quality of life, morale, and activity capacity lasted for at least 12 months, but were not observed at 36 months. And these findings provide relief for patients seeking standard treatment with a combination of chemotherapy and trastuzumab. Care and social support for at least 1 year is required when adjuvant chemotherapy is given in addition to anti-HER2 therapy in older patients with breast cancer. So, the addition of adjuvant chemotherapy into anti-HER2 therapy had a significant effect on global quality of life, physical and functional well-being, moral and activity capacity. And these effects persisted for at least 12 months. And after 36 months, no detrimental effects of chemotherapy were observed in any of the evaluated quality of life. Thank you very much.